What are some non-surgical solutions for the weight issues with polycystic ovary syndrome? Let's talk about it. Polycystic ovary syndrome affects 7 to 13% of adult women, and 70% are undiagnosed. PCOS can cause significant changes in metabolism, including those related to gaining weight, especially fat around your middle. Polycystic ovary syndrome is a metabolic disorder, contributing to insulin resistance and increase in adipose tissue. The best way to treat weight issues in polycystic ovary syndrome is to reduce insulin resistance, increase metabolism, and balance hormones, both sex steroids and adrenal androgens, naturally. Number 1, supporting your hypothalamus nutraceutically with Genesis Gold will help to increase your metabolism, improve insulin resistance, balance hormones, as well as lower androgens to help you lose weight. Number 2, exercise is key to reducing insulin resistance and losing weight. The more active you are, the more calories you expend. The increase in cellular metabolic activity, the more likely you're going to burn fat. Make sure you're doing aerobic exercise 3 to 5 times a week and weight resistance exercise at least 2 times a week to help you lose body fat and maintain lean body mass. Number 3, follow an insulin-resistant diet. Weight gain in polycystic ovary syndrome is caused by insulin resistance. An insulin-resistant diet can be key in losing that extra body fat. In my free Hormone Reboot Training, you will get access to the insulin-resistant diet I recommend for my polycystic ovary patients. Number 4, get enough sleep. When you get an adequate amount of sleep, which is usually 7 to 9 hours for adults, you have optimal immune function and optimal metabolism. Supporting your hypothalamus nutraceutically with Genesis Gold will help you get deeper sleep. Turning off those screens after dusk will help to increase your melatonin production at night. Making sure you're sleeping in the dark will allow you to have the highest levels of growth hormone to stimulate fat loss and increase lean body mass. Now, if you have any questions, please join me in our Hormone Reboot Training. I'll see you in the next video.